Over the past few years, I have continually followed an important topic with regards to unusual clotting patterns that were noted by embalmers. I must admit, in 2021, when I heard about died suddenly, I did ignore it because it sounded purely conspiratorial. However, as I continued to hear about it, my scientific curiosity was piqued. And eventually in 2023, I had an interview with Tom Haviland, who I've got here again today. And at that time, he showed me details from a simple survey about embalmers across the United States seeing unusual patterns. Once I had seen that and I looked at the science, I realized that there was something very important here. Over the next few years, and we're coming on to over 3 years now of looking at this kind of pattern, I also got a whistleblower telling me that this was happening in living patients as well. And it's important to note that once I heard that, I knew this was extremely important from a clinical perspective. We can no longer have a situation that strange patterns are occurring that could be relevant to health and continue to ignore them. What I've got here is two individuals who have been unwilling to leave this alone, and we have to appreciate the work that they have done over the past few years. So, without further ado, I'd like first to introduce Greg Harrison from Australia, and then I'll introduce Tom Haviland as well. So, Greg, can you just let us know a little bit about yourself?
Thank you, Philip. Yes, look, I'm a retired organic chemist. I used to run a polymer additives manufacturing business in Australia. We were making a range of polymer additives for a number of polymers such as polyethylene, PVC, polypropylene, polyurethane. And I became very familiar with the analysis techniques that we employed on samples provided by Richard Hirschman of the white clots. Now, what piqued my interest in these to do this work was watching a video on Epoch Times some years ago, I think it was back in 2021, where they showed an ICP-MS, inductively coupled plasma mass spectrometry analysis result of the white clots that Richard Hirschman had provided. And being very conversant with ICP, I noticed a high level of phosphorus that was found, tin, sulfur, sodium, and carbon. But there was a very notable absence of the what we call normal blood marker elements. In other words, potassium, manganese, iron, zinc, for example, were absent in the white clot. So this might pique my interest to try and replicate this work because I frankly couldn't believe it. And first of all, I was skeptical, like yourself, that the white clots actually existed.
Well,
However,
I'll tell you what, Greg, I want us to go into that in a little bit more detail. So don't worry, we're going to come back to that. But I want Tom to just give us a quick introduction first, and then we'll come back to that story. Tom?
Yeah, thanks for having me on the show again, Dr. McMillan. We've got a big breakthrough now. We have our first official acknowledgement from a United States State Funeral Director Association that these white fibrous clots are indeed real and they're quite prevalent. So, and we'll be talking about that. I got involved because in November of 2022, I watched that movie, Died Suddenly, the night it premiered. I called the Ohio Embalmers Association the very next morning after I watched the film, and I got confirmation from the now president of the Ohio Embalmers Association, Mr. Woody Wilson, that he was seeing the white fibrous clots. So that drove me and my friend Laura Kasner to conduct these worldwide surveys over the last 3 years in the United States, Canada, UK, Australia, and New Zealand to see just how prevalent these clots were, as well as the timing of them and whether or not the embalmers were seeing them.
Wonderful. This is very important. So again, just a reminder to anyone, if you have never heard about this, this is not at all a conspiracy. It is a very important scientific observation that has largely been ignored by the medical and scientific community. We will also be getting into why we think that was the case. So let's get back to Greg here a minute, because When you got involved, Greg, and you had seen that program, did you feel comfortable to be discussing the research that you were doing, because you then were triggered to do some research? Were you comfortable to do that publicly?
In my case, Philip, yes, I was personally, because I'm retired now. And although I still have contacts and access to some of this equipment and people who can run these analyses for me, I'm, if you like, independent of the previous constraints, whereby I am comfortable to talk about it. And to the point, though, I still must stress the fact that I have to preserve the anonymity of the technicians who did this work for us, because they are involved in universities, and the university did grant the access to the equipment. But I've been roundly criticised because I have not been able to demonstrate or present the actual data off the test equipment. Now, the reason that is, the universities has forbidden the release of this data because there are signatures in the data that will sheet it home to them. And they're worried about blowback, what we call the response that could come from authorities with regard to withdrawing funding from them, and the limiting of further research along these lines. In fact, they're very uncomfortable to be researching human tissues.
So this is an important point, Tom, and I'll come back to Tom on this here, because when you first started asking embalmers, they didn't feel comfortable to talk about it at that time either.
That's correct, Dr. McMillan. I was in touch with the embalmers, 6 or 7 that were in the Died Suddenly film, Mr. Richard Hirschman, John O'Looney, Laura Jeffries, Mr. Wallace Hooker from that film. But they were telling me that other embalmers just didn't want to talk about it. And sure enough, when I started running my worldwide surveys, I sent those out to over 1,700 funeral homes around the world directly, as well as to 50 national, regional, and state funeral director associations, each with hundreds of members under them, asking them to take this survey. And if everybody had taken the survey, I probably would have gotten somewhere in the neighborhood of 5,000 to 7,000 responses. But as you know, Dr. McMillan, in the last 3 surveys I've done, I've only gotten 179 responses in my first survey, 269 in my second one, and then my latest one at the end of 2024 had 301 responses. Good in terms of number of responses, but not the 5,000 or 7,000 that I would have liked to have had. So it's obvious that there's still a reluctance by embalmers, funeral director associations, funeral directors to want to take the survey and talk about this.
So this is important, and I just need to touch on this a little bit more, Greg. So in effect, the work has been done. The science is there that can be interrogated, but the universities are afraid of the implications, and so therefore they don't want the science to come out.
That is correct, Philip. The problem we have is the universities are stratified, and they have strict protocol with regard to ethics. In other words, the validation of where the samples came from, to have what they call a chain of custody requirement when you actually submit samples for analysis by the universities. They require the chain of custody to follow the ethics protocol. Now, in our case, that was not able to be followed because the professors providing the access to the equipment to us told us that we could have the work done, but we were not to divulge the university because of the potential blowback. And that's in a nutshell.
This is important because what I genuinely was concerned about was the fact that this information, for which it implies that there is a pattern occurring of clotting that we had never seen prior to the pandemic. The 2 big options are COVID infection, and the second option are COVID vaccines, or the third option is the combination of them both, which is somewhere where I am sitting. Now, this has clinical implications, and the fact that it is not being investigated raises an issue for the clinical community. But for many, they just say they don't have any good evidence that this is actually occurring. Can you show us these clots again, Tom? You know, in their minds, they think that you could have been playing around with calamari, stick it in some formalin, and just put it there. So they will not accept that as real evidence that this is there. What is your thought on that, Tom?
It's kind of hard to deny at this point, Dr. McMillan. Richard Hirschman has over 250 photos on his smartphone from over 250 different persons, deceased persons of the white fibrous clots. There's numerous samples going around. Like I said, you just saw the two that I showed you physically. When we'll talk about a little later, when I went to the Tennessee Funeral Directors Association annual convention on June 8th, I talked to embalmers in person. One of the very first ones I talked to pulled out his smartphone and showed me a photograph of a white fibrous clot that he had just removed in May. So it's very hard at this point for the naysayers to say that this phenomenon is not happening. We had just too much physical proof and proof on video footage.
I think that now that you've mentioned that, Tom, I think we should just show what was it that you were doing in Tennessee. Just before I show it, what were you doing in Tennessee?
Well, when I was running my 2024 Worldwide Embalmer Blood Clot Survey last December, we caught a break. I was contacted by the president of the Tennessee Funeral Directors Association, Mr. Taylor Moore. He said, "Hey, Tom, I'd love to have you come speak at our annual convention next June in 2025 to all my embalmers and funeral directors about these white fibrous clots." Because I think they understand we're into year 4 of this now, and these things are not going away. So I saw that as a golden opportunity, Dr. McMillan. So I traveled to Franklin, Tennessee, just south of Nashville, and on the 8th of June, gave about 55-minute presentation to those active embalmers from the state of Tennessee that attended the convention. And as you'll see, there's video footage of the embalmers basically saying that they are indeed seeing the white fibrous clots. I also took a paper survey at that convention as well.
So this is you speaking at the event, and you're showing them some clots, and so they are hearing about it. And when you ask them about the clots, about what was the response?
Yeah, I first asked them by a show of hands, how many of you are seeing, how many of you are active embalmers? And about 30 people in the room raised their hands when I asked that question. And then I asked them, okay, if you're seeing the white fibrous clots, keep your hands up. If you're not seeing the white fibrous clots, put your hands down. Only about 1/3 of the embalmers put their hands down, Dr. McMillan, which means 2/3 of the embalmers present in the room that day said they were indeed seeing the white fibrous clots.
So this is how many were seeing white fibrous clots.
That's how many embalmers are actively embalming right now. Now, in a minute in a minute, you'll see. I asked them basically if you're not seeing the clots, to put your hands down, and you will see a few of them put their hands down right there. But the majority of them keep their hands up. I then asked him, okay, and now if you're not an active embalmer, but you're a funeral director or a staff member, are you also seeing the clots? And then there was a couple more that raised their hands. They are not embalmers, but they wander into the embalming room. The funeral directors do sometimes to see what's going on, and a few more raised their hands. And like I said, those embalmers took a paper survey, so I nailed down the stats exactly of how many raised their hands and how many didn't, and we can go through those slides.
We'll come into that in a little bit.
Yeah.
So this is as I say, the important point. Let me reiterate it in case you're just coming in. This is real. Embalmers are seeing it. They acknowledge that they have not seen this pattern before, and yet the medical and scientific community are largely ignoring it, primarily because they think it's conspiratorial. And that was linked, I think, to the died suddenly presentation, because that became almost a political anti-vax kind of thing. But in the midst of it, people have gotten distracted from the science, the importance of the science. So I want to come back to Greg now, because in terms of what you guys were doing, I happen to know because I was contacted by a person in your group of scientists who shared with me some very detailed information. And it was very clear that they did not want to be known. What was the general consensus in that group about the implications of doing this research personally that made them afraid to be known?
It was purely the, and I dare I say, the quest for knowledge. We wanted to know what these clots were. We all realised they were taking us, when I say they, my proteges who were accessing the equipment were taking the personal risk. They were able to convince their professors who are overseeing their studies to allow them to do this work. And we all agreed that the risk would be worth it if, dare I say, the wheels fell off. Now, in my case, I had very little to lose because I am retired, I'm comfortable, and I don't have any concerns. But my younger proteges are still studying, and they are close to completing their studies, for example, and they've got a lot to lose, particularly if they alienate the professors above them that allowed access to the equipment. Having said that, and I'll choose the words carefully, the samples sometimes had to be disguised. They could not be classified clearly as what they were. They just had to be generally submitted without detail in order to get the work done. Because we approached a number of laboratories, and the moment we mentioned they were human, they said, no, we don't do that work. We're not qualified to handle human tissues. Now, this became a real issue for us, to the point we had to disguise and work our way around this, not by telling lies, but by describing them in a way that would pass through their protocol in order to do the analysis.
This is very important, again, because it demonstrates, because a lot of people keep thinking that if this was happening, everybody would know. And I'm saying you are underestimating how significant and how powerful the censorship was. Tom, you had been talking to medics as well. Now, just to put it into context, only in the past maybe 6 to 8 months, I have spoken to the first medical doctor in the world who was actually doing autopsies and saw these clots. And even then, that was a risk for him to come and speak out. Nobody wants to talk about this. What was your experience, Tom, when you were speaking to clinicians who were seeing this, acknowledged that they were seeing it, but would not say anything?
You know, like you, Dr. McMillan, you found a cath lab whistleblower in the United States. I found my own cath lab whistleblower in the United States. He's an endovascular specialist and cardiologist who works in Florida. And he came to me in March of 2024 with an email showing, actually sent a photograph of a white fibrous clot, which was a deep vein thrombosis that he had removed from a gentleman's calf, and said that he had been working with what he calls these devious clots for the last 4 years. So when that gentleman now has kind of gone dark on me. He sent me a communication later on that month saying, Tom, I've been instructed to terminate communications immediately. Sorry for the inconvenience. So obviously somebody got to him at his hospital, is my guess, and told him, hey, you're not to talk about this. But based upon that, I tried to run a cath lab worker blood clot survey in the middle of last year, 2024, and I sent it to about 120 vascular surgeons directly. I also sent it to the vascular surgery societies in the United States, Canada, UK, and Australia, New Zealand, and got zero responses, Dr. McMillan. The U.S. Society for Vascular Surgery, that's headquarters in Rosemont, Illinois, and brags about having over 63 member vascular surgeons across the United States, failed to take my survey. They refused to take it. So I got zero responses from vascular surgeons, endovascular specialists, cardiologists, people that work in cath labs from around the world in the survey. So then I decided if I can't get good information from the doctor in, maybe I can get it from the patient in. I ran a October 2024 People's Blood Clot Survey, which over 1,400 people responded to within the first 2 weeks. So the patients are happy to tell you about their blood clotting experience, but the doctors are staying silent about it.
Yeah, this is, what can I say? I'm a medic as well, and I understand how the medical fraternity thinks and works, the importance of peer-reviewed evidence so that they are not caught out with scams and so on. And the inability oftentimes to do the direct research, the fact that they potentially had to be in an academic institution that would then take these samples. And as you said, that chain of custody, Greg, that it's very clearly identified from which patient permission has, the whole series of steps there would require deep work to be done. Now, we did get this from Professor Kell. Professor Kell did manage in his institution in Liverpool to get some samples, and he recently published on it. And so Professor Kell and Professor Pretorius from South Africa are probably one of the first people to clearly identify amyloid inside these clots. And so it can happen. But as I had asked him when I interviewed him, why are not more scientists doing this work? And he said, well, it could be difficult. It's challenging. Maybe they don't have the expertise. Maybe they don't feel comfortable to take on these questions. But the problem is that it has clinical relevance. I want to come back to you, Greg, and I want to try and understand a little bit more about the work that you did in terms of your expertise and what made you comfortable or believe that you could find an answer to what was inside these clots. What were you doing before?
Okay, well, first of all, we ran a number of analyses. We didn't just start with the ICP. We verified the ICP analysis by having them run in 2 separate labs. But then we moved on to run a protein analysis, in other words, a thing called HPLC.
Hold on 1 second. I know what you're saying there. You're telling me the science, but I want to understand, what was it you were doing in your job prior to the pandemic that made you comfortable with doing this kind of work? What was that expertise?
We were analyzing a whole range of competitor products because we were making a range of what we call polymer additives and stabilizers for potable water drinking pipe and for a whole range of polymeric applications. We also sold tin stabilizers to the polyurethane industry and the silicone rubber industry. Tin compounds are used to initiate the polymerization of these polymers. Having said that, we had competitors coming in from all around the world, and some of their products were better than ours. They were more efficient, they could run at lower addition rates, etc. So we had to analyze them. And to analyze them, we had to use a whole suite of sophisticated analysis techniques. And those techniques included, as I said, ICP, HPLC, LCMS, XRF, Raman spectroscopy, a whole range of analytical techniques that gave us the actual composition of our competitor products. And then from then, we were able to calculate and improve the performance once we knew what we were dealing with. So it wasn't too much of a stretch to take a piece of rubbery calamari type clot and analyze it like we had done with some of the finished polymers we had that contain these materials. Okay.
Excellent. Yeah. So this is what I think people need to understand. You weren't just randomly doing this. You had expertise with doing this, similar to how Tom had expertise with doing surveys and the data analysis. That's what triggered you. And for the audience, it just demonstrates that this is not about medicine. This is about, it doesn't even have to be science. You use whatever you have and you can make an impact, and you can change the direction and the trajectory as to what is happening around you and in the world. Don't underestimate your power. I think that's the important thing, Tom, that you have highlighted. You are instrumental reaching out to so many people and still doing it and pushing this in front of the people that can make a difference. You were in contact with RFK, weren't you? Even before he was made HHS secretary.
Yeah, I've had a few communications with him, but not enough though. I'd still like to get a larger audience with him. So if he's watching, or people that know him are watching, I'd like to get an audience with RFK personally to talk about this, because this is the most spectacular, I think, side effect of what we call the elephant in the room. You know, we know about things like myocarditis, nerve damage, turbo cancers, miscarriages, but when this is the one you can see. This is the one that's hard to say it's not happening, because here's the proof right there.
Yeah, so this. Yes, you're right, Tom. It's very difficult to say it's not happening when you can show you can show this is it. So let's get to the science of what's going on here now. Okay. I have always maintained, so I can tell you where my journey was. My first thought was that these were not happening in living people. So it was post-mortem. And so my first thought was that they were something like cryoglobulins, where when the body cools, it makes all these clots. But when my whistleblower told me, nope, I'm seeing them, and again, just in case people don't quite believe what it was that he said, I had a whole bunch of images that he showed. But here is just one of them that he showed that was taken from the inferior vena cava. So a huge clot mixed with white and red material. So this was somebody who had clearly a very serious event. So once I saw this happening, I knew this was happening in living people as well. So my clinical take was that those kinds of clots are not really sustainable with an average person walking around. They either are very sick or they're dead. There is no other middle ground. And so in that vein, my feeling was that they had to be occurring very quickly. Because of my autoimmune research in COVID, I then said this has got to be an autoimmune phenomenon. So, Greg, we're discussing the science. When you saw these abnormal patterns in these clots, what caught your attention was the tin. Why was that?
Initially the tin, yes, because as I said, we were making and selling and formulating tin products for the polymer industry, okay, and it was highly unusual to have such a high level of tin in the human bloodstream, according to Mike Adams' ICP analysis. Tin is not the issue. Tin is probably a very small part and a toughening part, if you like, or cross-linking part of what is making these clots rubbery. The real issue is when we ran the HPLC analysis, we discovered there was a very high level of fibrinogen. And more importantly, there are three different types of fibrinogen. There's an alpha, beta, and gamma chain. And normally in a normal red blood clot, these actually begin to form fibrils or fibrin in an ordered manner, and it's a 1-to-1-to-1 ratio. When we analysed the white clots, there was like 9-to-4-to-1. It was 9 of beta, 4 of gamma, and 1 of alpha. And that's a highly unusual, aberrant pattern. And the actual content of the clot was, according to our analyses, averaged out at 56% of the clot of fibrin. That's an enormous amount of fibrin in a clot. And with a lack of iron, a lack of thrombin, and plasminogen and all the normal, if you like, clotting and declotting mechanisms, they're not there according to HPLC analysis.
Tom, you had sent me this image here showing, this is from Nature, the paper, the Nature magazine, showing the difference between human plasma normal clot with these fibrin strands making up the normal clot versus what happens here in terms of if spike protein was added to this mixture, and it then starts to become quite aberrant and quite abnormal. But there is something you just said there, Greg, that caught my attention. that I want to explore a little bit more with regards to what's going on. I recently spoke about hemoglobin and the hemoglobin subunits, because there's the alpha and the beta chain,
Yeah.
and each heme unit is 2 and 2. But when they looked at the clots, it was almost a 1-to-3 ratio of the alpha chains versus the beta chains. And as soon as you said fibrinogen there, that also seems to be an unusual. It's almost as if the fibrinogen is cut up into small pieces in order for it to aberrantly bind.
Yeah, this is a mystery of the mechanism, but you're quite right in pointing out the hemoglobin contents that were there. We were not familiar with what the pathway would be. And in fact, the research we did discounted the presence of hemoglobin, only to go back and find, after your kind research, that they are instrumental in forming a scaffold in the white clot. Now, there are papers describing this, and more importantly, the aberrant ratio you're describing is similar to the aberrant ratio of the fibrinogen. The reason the fibrinogen beta chain is so dominant is it actually polymerizes laterally first. It's the very first part of fibrinogen to begin to polymerize. It's then followed by the gamma and then the alpha, and normally in a 1-to-1 ratio. But what you're describing is also an aberrant composition, okay? So something is driving it. And from the ICP analysis, we believe the effect is phosphorus. We found 4,900 ppm of phosphorus in the white clots. This is at normally high level, and the human blood normally contains somewhere between 100 ppm up to maybe 1,000, perhaps 1,500 in a hyperphosphorylated state, but never anywhere near 4,000 to 5,000 ppm, which is what we found. So by focusing on the phosphorus finding, that drove us towards pathological pathways involving misfolding of proteins. Because when phosphorus binds with various proteins, it actually begins to misfold them. And that was a trigger that pointed us towards the work that Dr. Kevin McCann has now completed. And essentially, we had to draw the line because we had limited resources. But Dr. Kevin McCann now has continued the analysis of Richard Hirschman's white clot to fully confirm by 2 gold standard analysis techniques. They are the Raman spectroscopy and RT-QuIC analysis he has performed, that these white clots contain amyloid. And it's the highly eminent doctors like Dr. McCann now that we really have passed this over to, and Dr. McKernan as well, who we are hoping are going to continue this work, because they are operating at a much, much higher plane on equipment we could only ever dream of.
Yeah.
And it dovetails, doesn't it, with the work of Dr. Reza Pretorius on the microclots. He's also found that they contain amyloid misfolded proteins in the microclots.
That's correct.
Yeah. So as I said, I've spoken to both Professor Kell and Professor Pretorius. These are right at the cutting edge of the clotting mechanisms. And so they all know something abnormal is happening, but I still don't know if the clinical community is truly aware as to how significant some of these patterns are. I want to take you back, Tom, to your episode with the Tennessee Embalmers, and to look carefully at what it was they saw. And remember, for the audience listening in, we have already delineated that 1, these clots are occurring. 2, they have never really been seen before. 3, we don't know what the mechanism is, even though we may have some suspicions. And 4, nobody is seriously taking it on, except for some scientists who have always been willing to challenge the narrative, and we appreciate them for that. But they do it at the risk of being considered to be fringe scientists. And this is the huge challenge, because we need this to be mainstream. Let's look at what you found with your embalmers here. So this was done on the 8th of June at the conference in Franklin. Just take us through what this means here, Tom.
Yeah, a total of 28 embalmers and funeral directors took the survey, the paper survey that I handed out on the 8th of June at Tennessee. As you can see there, 3 of them do funeral directing only. Another 3 of them do active embalming only. But 22 of them, Dr. McMillan, actually are both funeral directors and active embalmers, embalming right now. That didn't surprise me too much. Richard Hirschman had told me that usually when funeral directors go and embalmers go for their licenses, they go for both at mortuary schools because a lot of the classes overlap. So they just say, I might as well just pick up both degrees. So, like I said, that wasn't too surprising. But the good news is there are 25 out of the 28 that responded to this survey from Tennessee are actually doing active embalming.
And so in question 2, so have you seen the white fibrous structures clots in the veins or arteries of your corpses during the first half of 2025?
Right. And this is an important question because, myself and my assistant Laura Kasner were very curious since our last survey was done way back in December of last year. We were curious about, what's happening in the first half of 2025. So these 28 embalmers and funeral directors from Tennessee are giving us our first look at what's happening in 2025. They're kind of the canaries in the coal mine. As you can see there, 18 of them said they are indeed seeing the white fibrous clots during the first half of 2025. And, only 10 said they were not. So this kind of matches that video you showed earlier of the raising of the hands. About 2/3 of the embalmers kept their hands up, saying that they were seeing the white fibrous clots, and only, about 1/3 of them lowered their hands, saying they were not.
In what percentage of your corpses have you seen the white fibrous structures or clots in 2025?
Yeah, if you average all the bars together, you get a average of 17% of the corpses in the first half of 2025 containing these white fibrous clots, according to the Tennessee embalmers. Now, this is down from the 27% of corpses that we got in our last worldwide survey, where we had 301 embalmers answer. So it's that hopefully that's a good trend, right? Hopefully these clots are starting to go away, and this could be a sign of the Bradford Hill criteria of reversibility. If you take the cause away, maybe the elephant in the room, then maybe the effect starts to go away. But another person actually commented on one of the other videos I've done recently on this subject, and he said, also think about the fact that you're taking this survey in Tennessee, and we know that's a red state here in the United States. So less adults over the age of 18 may have taken the elephant in the room. So you might see less corpses showing up with the white fibrous clots in a red state as compared to a blue state, where there's probably a higher percentage of people taking the elephant in the room. Now, that's speculation, but that is an interesting observation.
Yes, that is very true. Okay. And what is the longest white fibrous clot structure that you have seen removed?
Yeah, this is a question. We've never asked this question before. So this is a new one. As you can see, there are 9 of the embalmers said have seen a white fibrous clot that's 1 to 2 inches long. 7 of them said a 3 to 5 inch white fibrous clot. 5 of them have removed a 6 to 12 inch white fibrous clot. And there was even one that said he's removed a white fibrous clot that's over 12 inches long, Dr. McMillan. Shocking.
Yeah, that's important. And question 5, has a family member of the deceased ever asked you to look for the white fibrous clots in their loved ones?
Yeah, of the 28 embalmers and funeral directors that responded, only one said that a person has come to him and asked him that question, which I guess I'm not too surprised. First of all, this issue, as you know, is not that widely known. So a lot of people may not know about the white fibrous clots. Others that do know may be too embarrassed to ask the embalmer to look for that. Obviously there may be nothing unusual about the death, nothing to be suspicious about. But then I think there might be this subset of people who know that the white fibrous clots exist and may be causing these strokes and heart attacks, but they're afraid to talk about it and ask the embalmer, especially if that person, encouraged their loved one to take the elephant in the room. You may not want to know the answer to that question. That could have been the thing that killed your loved one.
One of the challenges that we face is the fact that it still feels like this is an issue whether or not someone is pro or whether or not someone is anti-vax. And because of that undercurrent, it seems that the scientific community, which has largely been very pro, don't feel comfortable to investigate it. Any thoughts on that, Greg?
I think you're right, Philip. There's so much invested in the mRNA technology. And to be fair, some of our research is still pointing back very much to the SARS-CoV-2 virus itself and the spike within. So it's too early to put it this way. I don't think we have any proof that it's one or the other. It's quite likely that both can be involved from the point of view of the SARS-CoV-2 virus itself, of course, with its natural spike, but also with the mRNA vaccines. Remember, the body does generate the spike protein itself. And secondly, the lipid nanoparticles that carry the messenger RNA around the body do lodge in a whole range of, if you like, critical organs, whereby they continue to generate the spike protein. So even if it is shown that if the natural spike is causing this, then there's a very good chance the mRNA generated spike could be perhaps a little worse.
I still believe, I wish it's still, sadly, it's still such a controversy that it's not easy to get the responses. But I believe that if I had a number of patients or relatives of patients who were able to give me the history as to what happened to the person who had the clot, I believe I'd be able to figure out the pathophysiology related to the symptoms. Because when I think about the case where Dr. Comrie had shared about he found, I think, about a 12-inch clot as well at post-mortem. And he had mentioned that the person seemed as though he had been well up to 4 days before, doing his normal runs and so on, had been fine, and then got a bit unwell and then subsequently passed away. And the detail as to exactly what happened would then give us a timeline for the creation of the clot. Because if, as I said, a clot of that size is not compatible with being asymptomatic, meaning that person may not have died, but they almost certainly will have swollen legs, they will have shortness of breath, they will have symptoms, they will not be feeling normal. And if you can get a timeline from when the symptoms started to when they died, you can then get an idea as to how long it took to make a clot of that size. And my instinct is that it's going to be very, very quick. Quite a rapid formation of a clot, but we still don't have a clear answer of the mechanistic steps.
That's exactly why it was such a shame that the vascular surgeon societies of cath lab workers did not take my survey last year. Because you're right, unlike the embalmers, these doctors do have access to the COVID vaccination records of all their patients. They can tell you when they took their shots, what brand they took, how many shots they took. And they could have given us valuable information in terms of when they found patients with the white fibrous clots they were removing from living patients, whether that person was vaccinated or not, and when they were vaccinated, that kind of thing. So I think it's just a dereliction of their duty. And remember, they didn't have to take my survey if they didn't want to. They could have done their own surveys, these vascular surgery societies, but they didn't. They haven't. So it's a shame. I think it's almost borderline criminal that they haven't looked into this. And, it's because they could have provided humanity with a lot of valuable information.
Yeah, I think that you're right. You're right. And I have learned that you don't try and defend the indefensible. I understand possibly where they may be, but it is still not acceptable if they are seeing this, which is very likely based on the numbers, is that even if it's 10% that are seeing these, they absolutely have a responsibility to investigate it and to raise awareness of it.
I know your whistleblower, you had found, said he was removing anywhere between 3 to 10 of these out of living people in his one cath lab alone every week. So,
Yeah.
wow.
So it does raise the point about the fact that there is no good excuse as to why this hasn't been thoroughly and properly investigated.
Yeah,
But
agree.
coming back to the history is that I suspect that the other important point that the cath lab and the vascular people will have is a detailed breakdown of the history of presentation. What were their symptoms? When did it start?
Mm-hmm.
And that is very, very important. And Greg, you were going to say something?
Only that the indications we have, I agree with you, the initiation of it is very, very fast. However, it's the accumulation process we think is a little slower. If this is a polymerization, as I said, predominantly fibrinogen with the hemoglobin subunits, then it is going to take some time. But the point that Tom raised is quite interesting, because we don't have access to the, assuming it is the number of infections, natural infections, or the number of boosters perhaps that have been given to a specific person suffering from these clots. We don't know what the cumulative effect is, and that could have an effect as well on the time frame for development.
Well, one of the things that I do say, and this was corroborated by a radiologist who was looking for them in elective patients, and he said quite truthfully he didn't see any. And when I think about what happens from a clinical point of view, if you had a clot of that size, you would see it on a routine scan of, say, for instance, the chest, a CT scan of the chest and abdomen. If there was a clot of that size, it would be seen by the radiologist, even if they weren't specifically looking for it. So I don't think this is occurring casually, because as I said, I'm aware of it. I see reports of CTs all the time, and we don't see those clots just there. And so this is why I'm saying is that it's very difficult for a clot of that size to be asymptomatic. It will almost always cause some symptoms. And so the history is then very important, because if from what it sounds like, it may be a 1 week history of someone starting to feel unwell. And the reason we are only seeing this between embalmers and cath labs is because they either have to be critically unwell or dead. And that's why we are then seeing it. But the question then is, Greg, when you think about the chemistry, what mechanism could make a clot form within days? Can you think of one?
Yeah, a catalyzing effect of some type. The indications are that the spike protein becomes phosphorylated, and that itself is highly reactive. And it's a catalysis pathway, we believe, and it's a pseudo-polymerization from what we can work out. But again, the actual formation of the misfolded protein makes it far more difficult to identify. And this is why the work, I go back to Kevin McCann's work. Dr. McCann's work is just so valuable now. This has to be the next step to fully quantify what these clots are. And by working backwards then, Philip, we can determine roughly what the mechanisms are that are driving this, and more importantly, then the time frame that you're concerned about. It's a very, very complex picture. And as I said, it's past our pay grade, quite frankly. We've had to pass it on to people like Kevin McCann and others who are far more qualified to do this kind of work, because at the end of the day, I am only a bucket chemist by trade, okay?
Yes, no, I understand. Tom, do you think it's possible, based on, I'm trying to think about how this can be done, even if it can be anonymous, where family members who know a detailed history of someone who was found to have clots, how can we get that together where that history, that detail can be found? Because it really is going to give the clue. I tell you what I think at the moment from, a clinical point of view. If we're seeing, and not if we're seeing, I'll show you what is being seen in the context of of the clots. And just so if people don't quite understand, the critical information that I found, and I'll show you this this slide here. The critical information was that there is a lot of hemoglobin subunit beta. This was in the young teenager. We can see the fibrinogen. The green is myeloperoxidase, which really suggests this is autoimmune. These are nets, neutrophils, or probably macrophages. And then again, hemoglobin. So the vast majority, 75% of the clot, is hemoglobin and fibrinogen, almost. That's one. Then you have the 25-year-old. This is much more fibrinogen with hemoglobin, myeloperoxidase, fibrinogen, and hemoglobin again. So just these three are again indicating that they are the main constituents. Again, 40-year-old. This is primarily hemoglobin. This one, 70-year-old, this one here is primarily fibrinogen and some hemoglobin. So when we think about it, this is beta chain fibrinogen, beta chain hemoglobin, and some alpha hemoglobin and fibrinogen. So technically, 4 proteins are making up the bulk of this. So when you put on that chemistry brain of yours, Greg, because it suggests in my mind that the only way you can have free hemoglobin is if the red blood cells are lysed. So yes, something is rupturing the red blood cells. The red blood cells ruptured the combination of maybe the free hemoglobin, the free fibrinogen, and maybe spike protein, and the enzymatic catalyzation makes a clot that could occur in hours or days.
There's another signature there, Philip, and that is the high level of actin that was found. I think you'll find actin was there at about 2.5% as well. That's come from endothelial lining damage. That's from the muscle tissue behind the endothelial lining. That's telling us there's extreme damage being done to the endothelial system. Now, that to me also is a marker that you're quite right. The blood cells look to be being destroyed along with the endothelial lining.
Yes, and so that would then fit with the theory I had, which was that the primary place that the inflammatory is occurring initially is in the lining outside the red blood, outside the blood vessels, the major blood vessels, what we call the vasa vasorum, and these then, that inflammation then comes into the lining inside, which is then the trigger and the ongoing process for the clotting. Something like that must be happening because it does seem to be very, very quick. What else can we do, Tom? How else can this be pushed? You've been doing a great job. You're like the Samson of this topic. What else can be done?
You know, I'm not sure what else at this point, Dr. McMillan. You know, like I said, unfortunately, the surgeons and vascular surgeons that could answer all these questions we've been talking about in terms of timing, how long it takes, you know, from patient histories from the time that they started feeling really unwell to the time that they have the clot removed. You know, we know that some signs are shortness of breath, tightness in the chest, you know, unusual fatigue, brain fog, poor vision problems can all be indications there's some damage going on in the vascular system. But it sure would be nice to have patient records from doctors. Now, I can go back to the 1,400 people that took my people's blood clot survey. There were a few of them that left email addresses, and I could try to find out from them more detailed patient histories of when they started to experience the symptoms of the clotting. I'm not totally convinced yet, though, that it's necessarily a rapid onset. I think it might be both. I think some people can experience rapid onset. Others may be delayed by maybe months, maybe even a year or two. I think it's possible for these things to be growing inside of people. And as long as the blood is still able to flow around them in the blood vessel, they may feel just fine, asymptomatic, until they have their stroke or heart attack, until, you know, the clot grows to the point where it completely occludes or blocks a blood vessel and then causes your stroke or heart attack. Some of the indications in the written, at the end of our surveys, we allow the people to write in detail about their particular experience. So some of the information we've gotten from those 1,400 people seem to indicate that may be a possibility. So I'll go back and see if I can get them to talk about it. But, it would be much easier if the surgeons who take detailed patient records would just come clean and come to us and let us know what's going on, because they already have this information at their fingertips.
Yes, quite right. So as we come to the close here, gentlemen, and this has been a very insightful and important discussion, I want you to think about what your takeaway would be to the audience that is listening. We're going to start with you, Greg, and then Tom. But I think that there is a responsibility to rebuild trust in science across the world. And sadly, this kind of situation does not help to give the public trust that people are genuinely trying to understand what has been done and whether or not there could be longer term harm. There almost seems to be an acknowledgement that even if it is, we would rather to be silent about it and just move on. That does not build trust. It does not stand up to the duty of candor, which from a clinical point of view, when we make mistakes, we are legally obligated to tell the patients and families. I hope this means maybe they're trying to say that we don't need to do that anymore. And so therefore, this has to therefore be representative to not just the clinical community, but the scientific community, who will trigger the clinical community to be able to discuss these things. But until that time, then the science is done, I think that they have a get-out clause. So where do we go from here? Greg, what are your final thoughts?
Okay, first of all, Philip, we'd like to see the authorities like the CDC, for example, the TGA, the FDA, have a look at these clots, at least do some basic fundamental analysis. In other words, prove us wrong, prove that our HPLC results are not correct, prove that the work that Kevin McCann has done, that they're not amyloid. We need someone from a higher authority to look at these clots, because the frightening scenario is, if this is a blood-borne systemic, dare I say, amyloidosis, this kind of pathology has never been seen before, and it's only occurred since 2021. So it's incumbent on the authorities to obtain samples. The samples are readily available, and not just from the United States. There are samples available out of Canada and out of the UK, for example. There are a number of embalmers who could furnish these clots to various authorities to have them properly analysed and the results published.
Excellent. And they have hundreds of millions of dollars at their disposal too, unlike your small team, Greg.
Well, we pay for our own pocket, Philip.
And so what are your final thoughts, Tom?
I echo what Greg says. CDC, FDA, university labs all over the world, get some clots, do an analysis of them. I also want to reach out to funeral directors, embalmers, vascular surgeons, cardiologists, endovascular specialists all over the world. It's time to come forward and talk about this. The silence has been deafening. It's been a shameful thing that these people have stayed silent about this. They need to come forward and reveal to the public exactly what they've been seeing the last 4 years. We have the Tennessee embalmers raising their hands, showing the whole world that, yes, they've been seeing these clots the last 4 years. This is not a hoax. This is real. These things are real, and they're prevalent, unfortunately. And we've got to get to the bottom of it and figure out how to stop it from happening.
I'd like you to show me as well, Tom, the big one that you had as a takeaway. Oops, sorry, 1 second.
That's okay.
Go ahead, show us that.
Yeah, this is a 5.5-inch clot, about 1/2 inch wide. This one was taken out of the abdominal aorta. It's one of the largest blood vessels in the bodies. This was actually taken out not by a fluid embalming, but during the embalming procedures, they also do what's called a cavity embalming, where they stick a device called a trocar in the abdomen to take out any excess gases or fluids, so the deceased does not look bloated during the viewing of the loved ones. And a embalmer, not Richard Hirschman, but another embalmer, actually caught on to the end of this on his trocar device and pulled it out. And he saw a little bit coming out of the corpse as he pulled out his trocar. Then he went in with a forceps and took the rest of it out. So just a shocking turn of events.
So yes, I think the reality is there. It can't be denied. The problem is that we still don't fully understand the science. And that requires a lot more investment and determination to try and do the work that will clarify this. So thank you very much, gentlemen. Really appreciate your input, appreciate your honesty, appreciate your service, the work that you've put in over the years. For you, Greg, even though you are here, we appreciate those who have been working with you quietly and are still quietly doing that research that has helped it to get at least to other researchers across the world. And for you, Tom, to continue pushing, don't stop raising awareness. The world needs more people like you both. Have a great evening, and thank you very much. And just wait with me for the outro.